Hi guys, welcome back to my channel. This video is going to be a part 2 of my endometriosis video. I'm just going to be going in a little bit more in depth of what excision surgery is. So yeah, I'm going to be talking about excision surgery, what it is, why not to get ablation, and I'm going to be showing you guys my scars and like pretty much everything. I'll probably even show you guys my pictures from my surgery, so actually I should probably find those. I'll be right back. So excision and ablation. So excision surgery is a surgery where an excision specialist goes in, so like they perform laparoscopy. Yeah, I think I'm saying it right. They just make little incisions in your tummy, and they go in with like cameras and stuff, and like just like different like instruments and stuff. So basically with excision surgery, they cut the disease out from the root. So let's say you have endometriosis on your large intestine. They don't just like burn it off like with ablation. They literally take it and they like excise it, like they cut it off from the root so it doesn't grow back. I believe only to like 5 to 10% of girls who have excision surgery come back to get a second surgery. And that's like a little percentage. If you go and get ablation, you have to go like every 6 months or like every year, and that just really sucks. Excision surgery has to be performed by an excision specialist, obviously. To know if your doctor is an excision specialist, you have to look them up on the excision specialist list that is on Facebook on Nancy Nooks. I'm gonna leave the link down below to that. You guys can join the group, and then you guys can see there's a list of all like the surgeons and stuff all around the world. Thankfully, my surgeon was only 30 minutes away. She is located in Gig Harbor, and that's where I had my excision surgery. Honestly, didn't know about excision surgery, but I'm like so glad that my first surgery for endometriosis was excision and not ablation, because with ablation surgery, it's really dumb. Like basically what they do is just they go in and they make little incisions, and instead of like removing it from the root, they actually just burn it off, and endometriosis grows back. And typically when they burn it off, it grows back a little bit like more worse, so that sucks, and you have to get it like every like couple months. And like just imagine getting surgery every 6 months. Like you barely are healing from like your last surgery, and then you have to get another surgery. Like that freaking sucks. If you guys think you have endometriosis, I really advise you to do your research and see an excision specialist, and make sure it's an excision specialist, because they will literally treat your endometriosis. Like literally excision surgery is like a cure to me. Like only like 5 to 10% of girls go back for another surgery, and the rest of them just live pain-free for the rest of their lives. Obviously, there is no cure for endometriosis, but in my perspective, I think excision surgery is basically the cure. I mean, like, it's the best treatment that's out there right now. So basically, let's talk about surgery. So surgery, you have to, I believe, stop eating and drinking. So my surgery was gonna be on a Friday, so I had to stop eating at 5 p.m. or 9 p.m. I forgot, I'm not really sure. Then stop drinking any like fluids and stuff at 12. It was like literally hell. I was like starving, so nervous, I couldn't sleep. Like obviously surgery is like no joke. Like you're gonna be put to sleep, and like obviously like everyone's biggest fear is like, am I gonna wake up again? So you can imagine how nervous I was. It was my first surgery ever. I never would have imagined I would ever get surgery. Like I would always tell myself like, wow, like I see all these people like getting their appendix removed and all this stuff, and I would always tell myself like, oh, I'm so grateful that I've never had to go through that. Hopefully I never will. And then when I found out that I needed surgery, I was like, oh my gosh, like this is actually happening. Because like my biggest fear honestly was that one day my appendix was gonna like burst, and I would have to go to the hospital and get surgery or whatever. You know, that happened to my dad and one of my close friends, and I was just terrified of that. So thank God they removed it during excision surgery, and I'm gonna tell you guys why in a second. But yeah, I was super terrified. But yeah, I only slept like 30 minutes that night, literally, and I got up, put on like really comfortable clothes. On my way there, I was just, all I was doing was literally listening to Christian music. I was just so terrified. I got there and everybody was really, really sweet. They made me feel so comfortable. Right when I got there, they made me do like a urine test and everything to make sure I wasn't pregnant, obviously. And then they put me in a room and they make you like clean yourself with like these wipes, disinfectant wipes, and then like from your whole body besides your face and like your genital area. And then they give you a special gown, and well, my gown actually had like this little like button where you pressed and there was like hot air, like I don't know, it just kept you warm. I don't really know how to describe it, but yeah, it was a really, really comfortable gown. And then you wear like these special socks, and then they make you clean like your nose with some like weird orange stuff. I don't even know, but you have to clean it like six times, like 1, 2, 3, 4, 5, 6, and then you take the other one and you're like 1, 2, 3, 4, 5, 6. It's literally like so creepy. Like everything they make you do is just so freaking scary to me. Like I don't even know. Like they put an IV. Okay, I need to turn this off. My surgery was scheduled to be at 7 a.m. It was actually supposed to be at 10, but then they like changed it or whatever. And it was like 5 a.m. I was there already, and then at 6:20ish, whatever, anesthesiologist came in and he was talking to me, and I was just so terrified. Like I don't know why, but I just like didn't like the anesthesiologist there. I just felt like he was just really straightforward and was like, yeah, well, I'm putting you to sleep, like, you know, I don't know. I just felt like he wasn't really comforting. But like, I mean, everybody in the group on Facebook would say that he was like really nice or whatever, but personally, he was like iffy to me. I don't know. But I told him, I was like, don't tell me when you're going to put me to sleep. Like, I'm absolutely terrified. I have, like, really bad anxiety. And then he's like, okay, I won't. Don't worry. And then he comes in with a freaking syringe full of, like, this pink stuff. And then he literally just grabs my hand and inserts it in front of, like, my parents, because my parents were there. And I was like, oh, my God. And he's like, this is the thing that I'm going to put before anesthesia or whatever. And I was like, okay. And right when he, like, put the syringe in my IV, I literally started feeling so freaking weird. Like, I started feeling like I was drunk. You know, have you guys ever been drunk? I just started feeling like everything was, like, really, like, loopy, like, really slow. And I looked at my mom and my dad, and I was like, oh, my God. I was like, it feels so weird. And as I was speaking to them, saying it feels so weird, like, they were pushing me out of the room. Like, I didn't even get time to say bye, nothing. Obviously, we had said bye already before, but yeah, so they, like, pushed me out of the room, and all I remember was being, like, I just, like, you know, like, when you get drunk and, like, you black out and, like, you remember some parts? I remember, like, some parts of, like, the halls where they were pushing me through. I remember they opened up the operating room, and it was freaking freezing in there, and there was, like, so many people, and, like, I was like, oh, my God. And then, like, after that, they were, like, carrying me onto the actual operating bed. And all I remember was saying hi to the lady that was there, that was, like, helping me or whatever. And then I think I asked her, when are you guys putting me to sleep? And then that's all I remember. Literally, that's all I remember. And it's so weird to me because I watched so many, like, anesthesia videos or whatever. And yeah, like, most, like, people who get put to sleep are, like, literally, like, awake, and they, like, see the syringe go in and everything. And I just, like, literally don't remember anything. And it was just so weird. So then after that, I don't remember waking up. I just remember being in my room, and then Dad was there, and then I was just acting really, really weird. The anesthesia was really, really weird. Like, I don't know why, but it made me so paranoid. Like have you guys ever smoked weed? Like, I know this is so bad. I'm talking about alcohol and weed and, like, videos and stuff, but, like, you know how you get so paranoid? Yeah, like, I was so paranoid. Like, I remember I thought the nurse was, like, wanting to kill me. Like, I just felt, because she wanted to give me this pill, right, that the doctor told her to give to me. And I was like, I remember hearing someone, like, screaming, I think, in the hospital. I don't know, I think it was just in my head. I don't know. But then I was like, yeah, no, I'm not gonna freaking take this. Like, in my head, I don't know if I told her, but in my head I was like, yeah, I'm not taking this. Like, you're freaking crazy. Like, you're trying to kill me. Like, in my head, I remember I was just so terrified. I was like, yeah, no. Like, I was so scared. And then I remember being on my phone and kept, like, falling asleep and then waking up and then falling asleep and then waking up. Like, I was trying to fight sleep because I was on these, like, really, really high drugs. And, like, I remember I kept grabbing my phone and then giving it to my dad and then asking for it back. And then he would give it back, and then I'd give it back to him, and then like it was like a back and forth, back and forth, back and forth. And my dad was probably, I feel like my dad was looking at me like, what the fuck is wrong with this bitch? Like, here comes the freaking vomiting part, or like, yeah, I felt like I was gonna fucking puke my guts out. Like, I felt so sick. Like, I was like, I need like a cold like rag on me because it's literally so hot in here. I was like, I feel like I'm gonna throw up. And then they brought me a bag, and then I like started like puking, but obviously nothing would come out because I had nothing in my stomach. And yeah, that felt just so horrible. And then I remember I was still high on drugs. They kept coming in to ask me if I wanted a room, and I kept saying I'll think about it, or maybe, or whatever, and they kept coming in. Mom's like, okay, I'm just gonna tell them that we do, because I was just so high that day. Like, I don't even remember like a lot of things. I was just acting really, really weird. But then I got my own room. I stayed there. They were all really nice and comforting. I don't know, my mom just wanted me to stay there. You know, moms, how they are. They were giving me like medicine throughout the whole night, and like I believe a few people came to visit me, but I was so tired, like so tired. Like, I knocked out. And then like the next day I was in so much pain. Like, oh my god, it just feels like stomach is literally like filled up with gas. Like, obviously during surgery they like pump your stomach up to have like a better view and everything. That's probably why it was hurting, but I was just in so much pain. And I was like walking around. They would make me walk around. So like they make you walk around for like exercise and stuff, and that, oh, that really hurt. It literally feels like your insides are gonna like just like fall out after surgery. Like, that's literally how it feels. And peeing is so weird. Like, you literally pee a little bit, and then you stop, and then you pee, and then you stop, and then you pee, and then you stop. I guess that's normal after. I guess that's like a side effect of anesthesia or whatever in some people. I was waiting to get discharged. It took me on a wheelchair, and I was like in so much pain because like the bumps like throughout the whole hospital, like the little elevator bump or whatever, like the sidewalk when they were like pushing me outside, everything just hurt so bad. Like, my stomach hurt so bad. I was like, oh my god. Even the car ride, because where we live there's like speed bumps. Oh my god, it was so bad. Like, it was hell. And like the first 3 days are like the worst. Like, honestly, I'm the type of person that does not believe in medicine at all. Like, I freaking try to avoid it as much as I can. Like, I don't like taking pills. I don't know. I just feel like you just can heal on your own. I mean, obviously if you have an infection, like obviously I'm gonna take antibiotics or like freaking ibuprofen and Tylenol and all that stuff, NyQuil. I don't even think you need that stuff. So yeah, I told myself, like, I tell myself that I'm like such a freaking warrior. Like, I'm so strong because I literally did not take any narcotics after surgery. All I took was ibuprofen. I think it was like 6 milligrams or 800 milligrams of ibuprofen. I felt like that didn't even help, like, at all, but like, I was like, yeah, I'm not taking narcotics. So yeah, my biggest fear right now is needing another surgery. Obviously, I'm better since before surgery, but I have been noticing like pain under like my left rib. That's kind of like always been there, but like after surgery it got better. But like, I just been noticing it, and I'm just like, I'm like praying that it's like not, like, I'm praying that my doctor did not miss a spot, because that would really suck. I told her about it, and she told me to give it a few months, and that if it was like still there, like if it was still like really painful, then she would have to go in one more time and take a look. Biggest fear is for me to have it on like my diaphragm and my lungs, because honestly that would really suck. I don't know, I'm just like trying not to think about it. Like, I'm trying to like just tell myself that it's all gone, that I'm healed, that I'm healthy, that she didn't miss a spot. But I'll keep you guys updated on my health. I'm actually starting pelvic floor therapy, I believe, on Thursday. Today is Saturday, so in a couple of days I'm gonna be going for my first session, and I'm so excited because my hip is really, really fucked up from this dumb disease. Basically, there was endometriosis on my appendix, and it created like adhesions, and like adhesions are kind of like a tissue, like scar tissue, and like it like attached to my PSOS muscle, and like some of the muscles down there just got like interrupted, I guess you can say, by the disease, and like it made my hip, so like my hips are supposed to be like this, but like on this side, since like this is where my appendix is and stuff, and where I had all my issues, it's literally like this. So I'm getting pelvic floor therapy to like strengthen my muscles back again, and it can get better. Hopefully, I'm praying. But yeah, after surgery they gave me a pictures of like my insides, because like she asked me if I wanted pictures of my insides, and I was like, hell yeah I do. So I'm gonna show you guys. So if you guys beware, if you guys don't like inside pictures or whatever, this is really graphic. So if you guys don't like looking at this stuff, I would suggest you skip the video or just exit out. Alright, so this right here is my uterus. I don't know if you guys can see it. Hopefully you guys can see, but that's my uterus right there. And these are my ovaries. So that's my ovaries. The other one's hiding under there. So there I have, you can see that I have endo right there. I have endo right there. So yeah, and then my uterus looks really bulky because my adenomyosis. Adenomyosis, like I explained in the other video, if you guys don't know what adenomyosis is, for those of you that are, I don't know, watching this video and haven't watched my other video, it's basically the same thing as endo kind of, but it's like inside the uterus. So it's like the endometrial tissue attaches to the muscle of the uterus and it weakens it basically. So that's why my uterus is kind of like bulky and stuff. Another like view of like my uterus. So this is my uterus right here. I don't know what this is, but there's endo right there. And my endo was not even severe at all. I was stage 1, but oh my god. Like, it caused me so much pain. Like I said in my other video, the severity of the disease does not matter at all. Like, you could have stage 1 with, like, intense pain, or you can have stage 4 with, like, no pain at all, not even, like, symptoms. Unfortunately, I was someone with, like, really bad pain with stage 1, but thank God they removed it. So yeah, I don't know exactly where this stuff is, but you can see like endo there under this like thing, under this thing right here, and then endo there. So in these pictures here, this is my appendix. At least that's what she said. I don't know. This is what she told me, so I'm just telling y'all. This is my appendix right here, and this is where I had like all my endo, I guess. So yeah, they only gave me like these 3 little pictures and stuff. But yeah, those are my insides. Real hot. I'm gonna show you guys my scars. And fair warning, I have a really, really hairy stomach. Don't ask me why. Okay, I don't know. I'm Mexican. Just a little heads up in case y'all want to be like, ew, what the fuck, or whatever. But I'm just telling y'all. So these are my scars. There's one of them, 2, and then I have one on my belly button down here. And then the third one's way over here. So my doctor used these 2 the most. This one, it's so weird because like I can't even feel anything right here when I touch myself. My doctor said it was because she used this incision and this incision the most with like navigation and like cameras and stuff. I'm gonna actually insert some videos of how they used to look. This is 4 months post-op, and this is my hip. This is what happened to my hip because of this. I don't know if you guys can tell. Well, obviously you guys can probably tell. But this side of my hip is lower than this side because of my muscle that was weakened by my endometriosis. It caused my pelvis to tilt. I'm going to be getting therapy to fix this because honestly, it's an insecurity of mine. But I just thought I would share that with you guys. I mean, I want to be like helping a lot of girls with like same issues as me. So yeah, basically that's all I really wanted to talk about. Thank you guys so much for watching. I hope you guys enjoyed this video. I hope it helped you guys and it gave you a little bit more insight into what endometriosis and excision surgery is. And I'll see you guys in my next video. Bye guys!